Okay, I wanted to finish up our discussion on the map of the human body that we began during our first class. And one of the things that we need to be aware of is this idea of body planes and sections. These are essentially flat surfaces that can run along different axes of the body that allow us to visualize internal structures in order to do things like diagnose disease. These flat surfaces can be used for anatomical study as well. The sections are cuts that are made along a body plane, and the three most common lie at right angles to each other. These are the sagittal plane, the frontal or the coronal plane, and the transverse or horizontal plane. The sagittal plane divides the body vertically into right and left parts, and so if you were standing in anatomical position, imagine a buzzsaw cutting you from the top of your head all the way down to between your legs, and you falling into a right and left half, and that would be a sagittal plane. And this produces a sagittal section if you cut along this plane. A mid-sagittal plane lies exactly at midline, so there's only one mid-sagittal plane in the body, while parasagittal planes lie in any other location. And so there's an infinite number of parasagittal planes and only one mid-sagittal plane. A frontal plane splits the body into an anterior and posterior part, so a front and a back. So if you're standing in an anatomical position, imagine a plane passing from the top of your head all the way down to your feet and cutting you into a front and back half. And that would be a coronal or a frontal section. Well, a transverse plane would divide the body into an upper and a lower half. So this would be, for instance, if you were standing in anatomical position and we cut you in half, say right where your hips meet your trunk, okay, and your trunk would be one half, your trunk and your upper limbs and head and neck would be one half, and the hips and the lower limbs and feet would be the other half, okay, that would be a transverse plane. And this produces a cross section, while an oblique section would be at an angle. And what this does again is can run at an angle either lateral to medial, it can run anterior to posterior, in any number of oblique sections are possible. And so what you're looking at here are just these different planes as they pass through the body. You can see here the mid-sagittal plane here, okay, cutting her into right and left halves. There's the frontal plane here, cutting her into front and back halves. And this is the transverse plane, cutting her into top and bottom halves. And you can see examples of some of the internal organs that you can visualize using some of these different planes and sections. This is a coronal section through the torso. You can see the lungs and the heart, the trachea. You can see the diaphragm. This is a transverse section through the torso, and you can see here this is the spinal cord. This is the vertebral column. This is the liver, and spleen, and pancreas, and you can also pick up the aorta. This is a mid-sagittal section through the abdominal pelvic region. You can see here the vertebral column. There's the sacrum and the coccyx, and you can pick up a little bit of the intestines, and you can see the hip bones as well, where they join in front. This joint here is called the pubic symphysis. Okay. Now there's also some body cavities that we need to become familiar with. There's two sets of internal body cavities that are closed to the environment, and they provide different degrees of protection to organs. There's the dorsal and ventral body cavity. The ventral body cavity houses the internal organs or viscera, and there's two subdivisions separated by the diaphragm. These are the thoracic and abdominal pelvic cavity. The diaphragm, as we're going to find out a little later on in the course, is the main muscle of breathing. It is a skeletal muscle that when it contracts will flatten and produce a vacuum around the lungs that will allow air to rush into the lungs. That's how we ventilate them. And when the diaphragm relaxes, it produces a positive pressure around the lungs, and if the nose or mouth are open, it forces the air out. Okay, and so it's also a major anatomical dividing line between these two cavities. The dorsal body cavity protects the nervous system, and this has two subdivisions: the cranial cavity that encases the brain, and the vertebral cavity which encases the spinal cord. And one of the things that you've probably noticed about these cavities, if you have a little bit of familiarity with the human body, is that the skeletal system does a pretty good job of protecting a lot of our vital organs. The bony thorax protects the lungs and the heart, and the cranial cavity protects the brain, while the vertebral column protects the spinal cord. Really the only vulnerable organs are the abdominal pelvic organs, and that's probably due more to the fact that um, early on in evolution, man decided to stand and walk around on two legs instead of running around on all fours, and as a result, the viscera, the abdominal pelvic viscera that used to be close to the ground when you're running around on all fours were now exposed when we decided to stand up. And so it's just a matter of evolution not having caught up to our change in body orientation that results in the susceptibility of these organs to damage. The ventral body cavity contains the thoracic cavity subdivisions. There's two pleural cavities, each which surround a lung. The mediastinum contains the pericardial cavity and surrounds the thoracic organs. And these, of course, are the lungs and the heart and the upper respiratory, the trachea, and the bronchi, and so on. The pericardial cavity encloses the heart. The abdominal pelvic cavity has a couple of subdivisions: the abdominal cavity that contains the stomach, the intestines, the spleen, and the liver, and the pelvic cavity, which contains the urinary bladder, the reproductive organs, and the rectum. And you can see these cavities here. Okay, you can see the dorsal cavities highlighted in yellow, and here's the cranial cavity and the vertebral cavity here, right? Your brain sits here. There's your brainstem, and then your spinal cord sits inside of here. And then you've got the ventral cavities, where you can see the thoracic cavity, which contains the heart and the lungs and the trachea and bronchi, the abdominal pelvic cavity, which contains the liver, the spleen, the pancreas, the large and small intestine, the stomach, the kidneys, and adrenal glands, the ureters, and then the bladder down here in the pelvic region. And again, you can see here the diaphragm, the major dividing line between the thoracic and abdominal pelvic cavities. And then if we look at this in an anterior view, what you can see in the thoracic cavity are the different divisions. These are the pleural cavities, there's the pericardial cavity, and then this whole area between the lungs is the mediastinum. Okay, so the mediastinum contains the pericardial cavity. And then, of course, below the diaphragm, you've got the abdominal pelvic region, as you can see here. Now, a lot of these organs are surrounded by serous membranes, also known as serosa. They're a double-layered membrane, and this is essentially a system whereby we can lubricate the organs so that when they move internally, they don't produce irritation, inflammation, and scarring. The parietal serosa lines the internal body cavity walls, while the visceral serosa covers the internal organs. And what they do is they secrete a fluid called serous fluid that lubricates the internal organs. And again, this is important because if we didn't have a nice lubrication job, what would happen as these organs moved around internally is that they would scar and inflame, and eventually they'd become damaged. Serous membranes are named for the specific cavity and organs they're associated with, and each has a parietal and visceral layer. Remember that the parietal layer lines the cavity inside which the organ sits, while the visceral layer is actually clinging to the organ itself. So the pericardium surrounds the heart, while the pleura surround the lungs, and the peritoneum surrounds the abdominal pelvic cavity. Now, you may have heard of some conditions that affect some of these membranes. Pericarditis, for instance, is a tightness in the chest that results from an inflammation of the pericardium. Pleurisy is an inflammation of the pleural membranes in which there's insufficient amount of pleural fluid made, and so when the lungs move when you breathe, they irritate, inflame, and scar, and it's extremely painful. And you may have heard of a condition of inflammation of the peritoneum called peritonitis, which is often an outcome of a ruptured appendix. Appendicitis can release fecal material into the abdominal pelvic cavity, and that can inflame the peritoneum, and as a result of that, the bacteria that are in the fecal material can sometimes enter the bloodstream, and that can produce a condition called septicemia. And so what you're looking at here is simply a look at what the pericardial cavity looks like. The heart, of course, is always moving, and it's contained inside the double-layered sac. There is the parietal pericardium, which is the outer layer of this double-layered sac, and of course the visceral pericardium, which actually clings to the heart muscle. And then there's fluid in between these two layers, and that's what lubricates the heart when it beats. Remember that the heart is always moving, and so if it doesn't have adequate lubrication, the organ will become damaged over time. Now, one of the things that we can do in order to have a map of the human body that's meaningful in terms of communicating between doctors and nurses and other clinicians, the chief complaint of the patient is to divide the abdominal pelvic cavity into quadrants. And you can see here that we can chop it into a 4-square grid: the right upper quadrant, the left upper quadrant, the right lower and left lower quadrant. And you can see beneath them there are certain important organs, and if the individual presents with pain or inflammation in these regions, the doctor can use his knowledge of anatomy to make a reasonable guess as to what might the problem be. And so you can see here in the right lower quadrant you've got the appendix, you've got the cecum and the ascending colon. Okay, in the right upper quadrant you've got the liver and gallbladder, a part of the stomach. Over here in the left upper quadrant you've got the stomach, part of the liver, part of the transverse colon. Okay, and in the left lower quadrant you've got of course, small intestine, the descending and sigmoid colon, and portions of the bladder. Okay, so knowing the locations of these organs, if the individual presents with pain in a specific quadrant, then this can be used as a clue in the diagnosis of what might be wrong with that individual. We can also divide the abdominal pelvic region into a tic-tac-toe grid, and you can see here the organs that lie beneath each of these regions. Talk a little bit about where these names for these regions come from. Let's start here with the epigastric region. Notice that your stomach is right here. Epi means above or upon, hence the name epigastric region. The right and the left hypochondriac regions refer to their location below the chondral cartilages, which are the connective tissue that link the ribs to the sternum. You can see them here and here. And hypo means beneath, and chondriac meaning pertaining to the chondral cartilage. The umbilical region is so named because it contains the navel or umbilicus. This is where the umbilical cord attached when you were undergoing development in your mother's womb. That was the lifeline between you and your mother's blood supply. And of course, it attaches to the placenta, which attaches to the uterus. The right and left lumbar regions indicate areas in the lower back. Okay, this is where the lumbar spine is located. The hypogastric region, or pubic region, is so named because it is underneath the stomach, okay, below it. And then the right and left iliac regions are so named because of their proximity to a portion of the coxal bone known as the ilium. Okay, so that's where those names come from. And you can see here what organs lie beneath each of these different quadrants. So if you had a patient coming in with a chief complaint, let's say that they had tremendous pain in the right iliac region, okay, they might have appendicitis as an example. If they had pain in the hypogastric region, we might suspect something perhaps with the bladder or perhaps with a portion of the sigmoid colon. Okay, just as a couple of examples. Now there's other body cavities that are exposed to the environment. These include the oral and the digestive cavities. And what you have to understand about the digestive tract is that it basically runs from the mouth to the anus, and your body surrounds it And so the food that you eat really isn't inside your body until it's absorbed across the lining of the gastrointestinal system and gets into the bloodstream. And as a result of these areas being exposed to the environment, in virtually every single one of these body cavities, what we'll find is that there is lymphatic tissue, which is the body's defense mechanism, nearby in order to guard against infection and disease. So other cavities that are exposed to the environment include the nasal cavity, the orbital cavities, and the middle ear cavities. Those that aren't exposed to the environment include synovial cavities, and these are essentially capsules that enclose bones in highly movable joints, which are called diarthroses. And they're filled with a fluid called synovial fluid, which is sort of like the body's oil. And what happens when the joint moves is that the synovial fluid allows a greater range of motion for this joint than if the fluid were absent. In a diarthrosis, what happens is that two bones come very close together, they almost touch, and they're enclosed inside the joint capsule, which contains the synovial fluid. And then there are structures such as ligaments and tendons that help stabilize the joint um, and control its movement. And we'll get into more of that when we get to the chapter on articulations. Okay, that brings us to the end of this portion of Chapter 1, and we will pick up with Chapter 2 in lecture when I see you in class. See you soon.